You're locked on to the number one radio station. Number one radio station.
All systems go.
And in your face.
Good evening, ladies and gentlemen, and welcome to the Joe Shmoe No Show. Today we have Dr. Allison Tarlow, who is a licensed clinical psychologist, and with her is Gina Arnold, qualified Alcoholics Anonymous sponsor. Welcome, ladies.
Thank you.
Thanks, Joe.
All right. So tonight, we're here to talk about the ethical differences and similarities between therapists and sponsors. So, first off, there's a big difference between being a licensed clinical psychologist and a sponsor at an AA meeting, right? So, let's talk about the formalities here, right? So, doctor, let's start with you. Being formal with a patient, can you go through the formalities of being formal with a patient as opposed to someone who is informal, like a Alcoholics Anonymous sponsor?
Sure, absolutely. Well, as a psychologist or a therapist, we are guided by certain rules and ethics that we have to follow. We have to have paperwork filled out when the patient comes in. They have to sign pieces of paper giving us what we call informed consent so that they are agreeing to embark on the therapeutic process. Typically, you will meet with them in an office or some kind of official business setting, and it's usually for a set amount of time, generally anywhere between 45 minutes and an hour. So there's a lot of rules and regulations that we have to follow that keep it formal.
Oh, right. And you described a lot, and obviously that comes with being a doctor. Now, Gina, being a qualified AA sponsor, that's more informal, but let's talk about what you go through, meeting with a sponsee.
I'm glad that you asked me that, Joey. While clinicians follow codes and guidelines of company policies, sponsorship is more along the lines of investing their time in a recovering addict to guide them through a 12-step process.
Okay. And so you're saying that being a sponsor, pretty much the only formal thing about it is the anonymous part.
Well, that's true. Ethics versus being moral or, having values, it's what's good and desirable as opposed to doing what is right and correct.
Okay, so doctor, quick question. If you had a client who came in who was showing suicidal tendencies and said that they wanted to harm someone else or themselves, you would legally have to have them Baker acted, correct?
Absolutely. I would have a responsibility to go ahead and do everything in my power to keep them safe, which may mean calling 911 or getting them to the hospital and having them, as you say, Baker acted, yes.
And what would happen if you didn't do that?
I could be held responsible.
Okay, and now Gina, as a qualified Alcoholics Anonymous sponsor, someone confides in you that they're suicidal and wants to harm somebody. Do you have a formal responsibility to do something about that? Or if you chose not to, what would happen?
Joey, that's a good question. I think ethically, I'm not bound by professional laws, but morally, I would want to do something for sure. Everybody's lives matter.
I agree.
I would have to take into consideration with the person I sponsor. I would not try to go behind their back and do something that would be hurtful or spiteful, but try to sit them down and, tell them that I would be morally responsible to call 911 if that came up.
So, all right, so staying on the top of Alcoholics Anonymous, we know that there's a 12-step program. How long generally does it take one to go through the 12-step program? And is it time sensitive?
I don't think sponsoring somebody through a 12-step program is finite. It could be indefinite. Like I said, investing in another recovering person is personal. It's a long-term relationship. And the difference between sponsorship and clinicians is that we offer a deeper, more intimate relationship based on trust, a level of trust, and we can outright give advice, and regularly I would be available 24/7. I don't know if that would be Allison's case.
Okay, and so, doctor, so basically when you have a client, is it routine for you to set up like a 6-week treatment program or a 2-month treatment program?
Well, yes. I mean, I think a couple of things. First of all, we live in a time where insurance companies dictate a lot of the treatment that we do. And so while as a psychologist or a therapist, I might feel like this is something that could go on for a longer amount of time, the treatment may be dictated by the insurance providers who say, we're only going to give you 6 sessions, or we're only going to give you 12 sessions. So from that perspective, it is time sensitive. There are people who come to therapy who don't go through insurance, whether or not, they're private pay. So you have a little bit more leeway with that. But in general, when you have achieved the goals that you set initially, the right thing to do at that point is to bring the relationship to a close, to terminate.
Okay.
Right.
Okay, so as a doctor, you are guided by laws and company policies, and after a client's, let's say, 8-week program is up, the relationship is cut. As
Yes.
opposed to, correct me if I'm wrong, Gina, in the AA field, as long as you're anonymous, you can stay friends with this person and spiritually guide them, because obviously this
That
is
would
more of
be
a
true.
spiritual practice for as long as as it takes. Like we said, there is no time limit really with the 12 steps.
That's true. But in Alcoholics Anonymous' defense, we do want to work fast and furious to get the new person through the 12 steps so they can carry the message. That's how AA stays whole, or we die.
Okay.
It's been around for 83 years because we do that.
Doctor, another question. How do you approach a client who has religious or spiritual needs?
So one of the things that we do is when we first meet with the patient or the client, we assess them in a number of different areas. The important thing as a psychologist or a therapist is really to be sensitive to meeting the client or the patient where they're at. So if they have particular religious or spiritual needs or wants, or they come in with a particular set of values, we need to be able to respect that, and we are also ethically bound to explore our own issues. So for example, if I had someone come in that was of a religious background that for some reason I wasn't either familiar with or I wasn't comfortable with, I should either educate myself or I should refer them to another therapist who would be able to help them in a non-biased way.
Okay, and for you, Gina, obviously it's a little different because the AA process, correct me if I'm wrong, is guided on the higher power principle.
Yeah, that's correct. I think the comparison with clinicians, excuse me, is that they can diagnose their client, and with sponsorship, we humbly offer the fellowship. It's not imposed. Everybody wants to find what their purpose or meaning of life is all about, but being a low bottom drunk or alcoholic, usually there is no more human solution for people like us. And the last thing that addicts or alcoholics usually try is the higher power thing. God. They don't like that. The word God will drive them out, but if they live, alcohol and drugs will always drive them back in. So in most cases, what clinicians might find unethical, it might be harmless to us. We don't want to endanger our relationship, but to approach the issues of spirituality, it's practical. It's not a religious program.
Yeah.
Spirituality is practical for us,
Mm-hmm.
and Alcoholics Anonymous is compatible. There's old people, young people, people of all religions, people of all ages, people of all colors.
All right. Well, let's see. We've talked about some differences between therapists and sponsors, and I want to go into some similarities. And so I hope that we would all agree that some similarities between both of you would be confidentiality, trust, and public safety. Can you go into what it is to be confidential with a client?
Absolutely. So confidentiality is really a cornerstone of doing therapy. And it's essential that when somebody comes in to work with a therapist, that they can have complete trust that whatever they're sharing in the room is going to stay there. The only way that we can break that confidentiality and speak outside of the room to another person or party would be to have the client or the patient signing a piece of paper that we call a release of information that allows us to then share the information with whoever it is that they've specifically agreed that we can share it with. Of course, there are some slight differences that we talked about earlier, just in terms of if a client's going to harm themselves or even harm someone else, then we are allowed by law, by ethics, to then break the confidentiality so that we can notify the police, or if we know somebody wants to go harm, Tom Jones, their neighbor, then we do also then have the ability to contact and say, that this person is going to be in danger. So there are some outs for the confidentiality, but in general, we could lose our license and be fined and get into a lot of trouble if we were to break confidentiality. So it would harm the relationship, but it could also harm our livelihood.
Absolutely, I agree. Gina, being in the Alcoholics Anonymous scene, you're not at risk for losing a license. What are you at risk at breaking confidentiality with your sponsees?
Joey, I just want to back up a bit because although therapists might have a goal or a set that they can work through therapy-wise with their clients, it is our belief, or as a qualified sponsor, that lack of power is our dilemma. So where and how we define this power. So we have to plug into a power, which for me, it's God, that unlimited source.
So you're saying that there has to be a sense of maturity to be a sponsor, and that it's reckless and immature for someone like you to have a sponsee confide in you, for you to go ahead and put their information all over, like, let's say Facebook or social media, is just, you shouldn't even be there in the first place.
That's true.
And would you say that Alcoholics Anonymous sponsors are highly dedicated to what they do?
They're highly dedicated. We're bound by the fellowship and the 12 steps, and we're willing to guide the person that hasn't gone through the 12 steps yet.
Let me ask you a question. Be honest, and you don't have to answer it. Do you feel that more people are helped through the spiritual practices of Alcoholics Anonymous, or the guided laws and company policies of doctor and licensed clinical psychologists?
That's a really good question, Joey. I think most people have to go through the process of treatment. And I believe without that framework and the statistics of recovery, our practices would be greatly diminished. My role as a sponsor is more long-lasting and intimate, which aids the recovering person on a level, if they're willing and ready to receive. It's as a result of successful treatment. So I'm not for or against treatment.
Yeah.
Can I jump in there?
Absolutely.
So I think it's a great question, and I love what Gina said. And for me, I am sort of envious of the relationship that a sponsor can have with a sponsee, because as we discussed, when the psychotherapy relationship ends, that's it. It's a break in the relationship. We're not hanging out, having coffee, nothing like that. So we can do some treatment work, and then at some point it is finite, it comes to an end. But what's valuable is then you have a sponsor in place who can really be there at all hours of the day and night. I think the message that I've heard from patients or clients who have sponsors or sponsees is that they are available 24/7.
Yes.
And able to share with them on a more personal level. So I think that it really can be used hand in hand.
Let me ask you a question, doctor. Do you think it's the common opinion amongst licensed clinical psychologists that the AA route is like it doesn't work, like it's not the right thing to do, or it's just like hocus pocus?
I think that there's probably some stigma attached that misinformed clinicians might believe that it's a group of people who are non-professionals in a room, and therefore if they haven't had that training and whatnot, that they may not be able to help as much.
Yeah.
But I think that's really doing the 12-step programs a disservice. And what I would like to see happen is for more clinicians to educate themselves on how powerful the steps could be, whether you are struggling with addiction or alcoholism or not. I mean, there's a lot of valuable lessons to be learned in going through the steps and following the tenets of the 12-step program.
I agree.
Yeah.
I think the value of one addict or alcoholic helping another is without parallel.
So, okay, doctor, in your practice, you don't only see alcoholics though, right?
Correct.
You might see other things, whereas you are in the AA, so you only see alcoholics, right? So obviously your advice and your opinions are going to differ from you because in the AA scene, you specialize in AA. But let's say you both have an alcoholic in your presence. Would you agree that your advice and your opinions are going to be different from hers, or are they subconsciously the same?
I think that it would depend on the therapist and depend on the sponsor. But I would say that knowing somebody like Gina and how she, knowing her for a number of years and how she works with people as a sponsor and with people who are in recovery, I feel like a lot of the message would be similar. And that's what's really nice, is it gets to be really sort of, you can work hand in hand and know that this person is going to get the best possible of both worlds. But I think that, the truth is, though, I've also been in meetings where I think they encourage people to not talk about therapy or professionals or things like that. So while I think I'm pretty open-minded about 12-step programs and sponsors and sponsees, I think that there are people in the rooms of 12 steps who tend to believe like their way is better.
Yeah.
And that, the professionals maybe are not going to do as much for the alcoholic.
Do you believe that let's say addicts in general are powerless?
Yes.
You do? Mm-hmm. Okay, so therefore you agree?
That's good to hear.
Yes.
I do agree. Lack of power is our dilemma. We're powerless over a lot of things. People, places, things. And once, you can admit that, I think it's half the battle. Acceptance, but it doesn't always mean you have to like it. Acceptance is good, but the real thing is to surrender. It's an inanimate object. You're a slave. Like a good slave, we do what our master tells us to. Mm-hmm. And I think a lot of people nowadays in Alcoholics Anonymous are drug addicts. We have to be tolerant. We have to be more tolerant today. And I'm glad that you had us on the show tonight. I think neither Dr. Tarlow or myself has a very firm understanding of what the real importance is here, but heart-wise and soul-wise, we both want to help struggling addicts and alcoholics, and I think both of her profession and my qualifications,
they both help
have
people.
merits to the
both help
recovery
people.
process.
All right, well, tonight we've discussed the ethical differences and similarities between therapists and sponsors. First off, with all due respect, Dr. Allison Tarlow, thank you very much for your time.
Thank you for having me
and
on
Gina
the show.
Arnold, oh my goodness, frequent guest on the show.
That's true.
It's always a pleasure to see you.
Thank you so much. I
And
hope you have
thank
me
you,
back.
and have a great night.